welcome back to Liv'n Life Unfiltered. I'm your host, Kendall, and the podcast where it's a wellness conversation with your friend, except we brought the expert too. As we age, our ability to perform, enjoy intimacy, and function at our best can change. The reality is that sexual health is a normal part of overall health, yet many people hesitate to bring these conversations up because they feel embarrassed or they think it's simply part of just getting old. To help us navigate this conversation, I'm joined by Dr. Yoann Millet.
That is
Yoann
it.
Millet, Director of Sexual Health at Vitality. Dr. Millet, thank you so much for being here.
Absolutely.
Before we dive into today's topic, I'd love for our listeners to kind of get to know you.
Sure thing. So, my background is a little bit different than people would expect for something like sexual health. I'm actually board certified in pain management and in anesthesiology. But I've never been focused on just treating disease. I've always also wanted to improve patients have the best quality of life that they could possibly have. And so what I noticed in the pain clinic is we write a lot of opioid medications and narcotics, and those medications are going to impact our pleasure centers or reward centers in the brain, or our libido or hormones. And so I had a lot of patients that were having side effects from these opioids that were impacting a lot of things, including their sex life. And because I've always had that focus on getting quality of life better, we were already branching out into doing regenerative therapies in the pain clinic. And I was interested in helping patients get better as concerns their sex lives and these side effects.
I think that sexual health is, like I said, very embarrassing to talk about, but it's super important for people to understand. So, usually, what I do with my videos is I like to start off with a common myth. One myth I came across during my research is only older adults need to worry about sexual health. Why is sexual health important for all ages?
So sexual health is just such a big important part of our lives. Just as being humans, sex is important. People get a lot of fulfillment and well-being and connection out of sex and sexual experiences. There is a misconception that as we get older, men's testosterone levels are going to come down. Hormonal changes will affect older adults. Women, after going through childbirth or through menopause, are going to suffer from sexual dysfunction. But that's not entirely true. Younger adults can also have sexual dysfunction problems. For example, chronic stress, lack of sleep, mood changes, obesity, hormonal changes even at a younger age. There are all sorts of things that can start much earlier in life and impact people of all ages.
Yeah. And I think one of the biggest reasons these conversations matter is because sexual health concerns are incredibly common. While some changes can happen naturally as we age, they aren't always something people should accept or ignore. According to a Cleveland Clinical article, erectile dysfunction affects more than half of men between the ages of 40 and 70, and many cases go unreported because men are embarrassed to seek help. And erectile dysfunctions often gets associated with aging, but is not always caused by age. What are some common causes of erectile dysfunctions in men?
Right, so what you said is absolutely correct. It's probably an underreported problem. People are embarrassed to talk about it, but it has a very big impact on men's sexual health. So, erectile dysfunction by itself is not a disease.
Yeah.
Most of the time, it's actually a symptom of something else that's going on. So, that can be a whole slew of different things. A lot of times, it's a different medical problem that can affect the ability of a penis to get erect. So,
Right.
blood flow supply issues are a big one. So, people with heart disease, people who have diabetes where the blood vessels are smaller, people who are smokers,
Okay.
people who have nerve issues, whether that's from surgery like a prostate surgery or from an injury, are going to have problems with erections.
Right.
Sometimes it's going to be a medication side effect. There are a lot of medications like antidepressants are a very common one that can decrease libido and cause erectile dysfunction. And then, of course, we have psychological factors as well. So if someone's having problems in a relationship or performance anxiety, some of the things I mentioned earlier are also very common causes of that.
Yeah. And while erectile dysfunctions are very important for men, there are also concerns with women as well that they face challenges for their sexual health. According to a Mayo Clinic, changes in women's sex drive can happen throughout life, and those changes can become ongoing or start affecting daily life or relationships. When women notice changes in their sexual health, what are the most common concerns for them?
So they experience a little bit different symptoms than men. Of course, we're not going to have erectile dysfunction. Uh, Decreased
Yeah.
libido, vaginal dryness, which can lead to discomfort with intercourse, are very common. For women, there can be issues with the pelvic floor getting weaker, and a lot of times that will mean losing control of the urethra and having some leakage as well. Women have a very complicated sexual
Yeah.
physiology. Men too, but women have a lot more hormonal changes
Yeah.
with menstruation, with menopause coming down later in life. And so, in addition to the factors I mentioned for men, hormonal changes play a very big role. I don't know if I mentioned that it can also affect men, but for men and women, they can.
Yeah.
And the good news is that we have treatment options, whether it's for men with erectile dysfunction or women with just generalized sexual dysfunction, to try to help them get better.
Yeah, and with the treatment options, you just mentioned, it's a good news for patients to have these treatments. So, according to Cleveland Clinic, the Parabis shot, known as the P shot, is a treatment that uses a person's own blood to create an injection, and it is commonly used in areas of medicine to support healing in tissues like muscles, joints, tendons, and ligaments. Dr. Malay can go a little bit more on the details of what exactly the P shot is.
Sure. So I'd start by telling you what PRP is.
Right.
PRP stands for platelet-rich plasma. Platelets are the factors that when you have a cut in your skin are going to help scab and cause that area to heal. And so they're loaded up with all sorts of different growth factors and signaling molecules to tell your body, hey, there's been an injury in this spot. So PRP means that we take blood from the patient, so it's your own blood. We spin it down in a machine called a centrifuge, and it will allow us to concentrate those platelets into a fraction of a blood. So instead of just being a small amount like you would get with a cut, we can get a very strong, hyper-concentrated amount of these platelets and growth factors, and we can inject them into various different tissues for different reasons. For example, tendons and ligaments we will do for pain. When it comes to sexual health, we can do the procedure that you mentioned called the P shot, which is a procedure where we inject that same PRP into different parts of the penis tissues to try to improve blood flow and heal from injuries and improve some of the symptoms that can happen with sexual dysfunction. So the P shot can work. I don't want to pretend like it's a cure-all by any means.
Yeah.
So say someone comes to our clinic for a sexual health evaluation and they have erectile dysfunction. So I will talk to the patient and do a full medical history and just get a comprehensive understanding of what their goals are, what the problems have been, what the medical history is, because some of these medical issues can also contribute, what medications they're on, what their social history is, meaning are they smoking, are they drinking, are they doing different types of drugs, just all sorts of things that can affect erectile dysfunction.
Mhm.
Then usually we will do some additional diagnostics, which means blood work, looking at various different things, but very importantly, hormone levels like testosterone or thyroid levels. And then after we have all of that, we try to make an individualized plan to say, hey, this is probably what's causing the erectile dysfunction. Let's target that. If there's a targetable cause, we do that. If there's not, and they're a good candidate for trying to do a regenerative injection like the P shot, we talk about that. We talk about some of the benefits that you can get, such as better blood flow, sometimes increased girth, better sensitivity. And we also talk about the evidence that's still coming out, right? These are relatively new treatments and they've been very effective for many people, but we still have ongoing studies that are out there. So they're not a cure-all for everyone either.
Right. And with that, there's also the O shot for women, and according to Cleveland Clinic again. The O shot, also known as the orgasm shot, is an experimental platelet-rich plasma injection that has been used for vaginal health concerns. So, Dr. Malay, can you explain what the O shot is for women?
It's very similar to the P shot. It's the same PRP that we just discussed. It's the same concept. It's going to get injected into different parts of the vaginal tissue this time. And the goal is to increase sensitivity, arousal. Some women report increased libido with it, lubrication, and interestingly, it can increase the tone around the urethra, which is where
Right.
urine comes out. So for some women that have some dysfunction and leakage, it can help with that. We usually will combine it with pelvic floor strengthening exercises. So we have a machine at Vitality that actually uses electrical currents to strengthen the pelvic floor. It's kind of like physical therapy for your pelvis, kind of like Kegels. And so the procedure is a very quick outpatient procedure. We use some very small needles after numbing the areas that we're injecting, and we deliver the PRP solution to the target areas. You asked me earlier about recovery from these
Right.
procedures. Just in general, because they're so minimally invasive, and again, using the patient's own blood, there's usually maybe a little bit of soreness or discomfort in the area for a day or two. We usually recommend abstaining from any kind of intercourse for those a couple of days. But after that, most patients can resume normal activities.
Okay. Yeah, that's really cool. And according to a Cleveland clinic, sexual dysfunction can affect people of all ages, although it becomes more common after the age of 40. Research suggests about 30% to 40% of people experience sexual dysfunctions at some point in their lives. Many people feel embarrassed, like I said, to discuss sexual health and all these concerns. At Vitality, how do you create a comfortable environment for these patients?
Well, first we tell them that they're not alone. I'm a physician. I have difficult conversations about awkward topics of all sorts with patients every
Yeah.
single day. So it's normal for me. I understand it's not normal for people walking in, but it's a judgment-free zone. We're here to make people feel better, not to judge them. Everything is confidential, and I've probably heard all of it before, right? It's incredibly common, like what we talked about. Being embarrassed delays treatment and really can rob people of a better sex life, which is so important. And we offer many options at Vitality. We talked about the P shot and the O shot, but we do hormone optimization if the hormones are not balanced. We do weight loss if obesity is a problem, with various different strategies that we use for that. We do the pelvic floor strengthening. We work with different experts in different fields. We're really trying to get people better, and sexual health is what we're talking about today, but it's one of the many pieces of that puzzle. And
Yeah.
sometimes, if it's even one of those psychological factors, we can help with stress coping, with better sleep schedules. We can help optimize different medications, but we can also work with different medical specialists that are prescribing those. We can work with counselors, couples counselors, psychologists to treat whatever is causing the issue.
Right. I mean, even going into this interview, I was really excited for it, but I knew, like, going into it, I was like, oh, this might be embarrassing because sexual health is embarrassing for anyone. And for someone who's listening who's been experiencing these types of changes in their sexual health, but has been kind of hesitant to go and actually ask for help, what's the biggest piece of advice that you would give to them?
To come in and not be embarrassed, because you're not alone. It's incredibly common. And really, the longer you delay getting it evaluated, the more we might miss one of these other big medical problems that might have a significant impact elsewhere in life. But also we might lose some of our options. So the earlier we treat things, the more options we have. And we don't want you to rob yourself of having this very important part of your life. For example, getting older is okay, and it's something that's going to happen to all of us, but it doesn't mean that you have to be robbed of intimacy. And there are ways that we can help no matter what the cause of the sexual dysfunction is. So my advice is really to encourage people to come in, do a consultation, at least talk to us, at least let us do some diagnostics, at least let us give you an answer. But we're here to make you comfortable, and we really believe we can help most people.
Right. Thank you, Dr. Millet, so much for coming in and joining us, helping us kind of understand this topic and how it affects so many people, but is not really discussed. I think today's biggest takeaway is that sexual health is one of the most important things to talk about. There's a lot of things that go with sexual health, like whether you have low libido, erectile dysfunctions, painful intercourse changes of after menopause, intimacy concerns. All of those they're treatable, and no one should really feel embarrassed to ask for help. And having an open conversation with a qualified healthcare provider is so important and is often first step towards improving that you can break that barrier of not really being embarrassed anymore. If you enjoyed today's episode, be sure to comment down below, like and subscribe. There will be more episodes coming out soon, and we'll see you guys next time. This video is produced and owned by Vitality Hormones and IV Bar.